विश्वतापो यन्तु विश्वताः।
Complaints of mass per vaginum since 3 months, white discharge per vaginum since 45 days, with complaints of backache, difficulty in walking, with no micturition and defecation disturbances. On examination, she looks paler, with third-degree uterovaginal prolapse, with cystocele, with rectocele, with decubitus ulcer, with deficient perineum. Diagnosis?
How will you examine this patient in OPD? Would you like to examine initially with full bladder, or you ask her to empty the bladder and come?
Examine with full bladder, sir.
Examine with full bladder. For what purpose? What you will see with full bladder?
Stress incontinence. First we rule out first.
Stress incontinence. Can you make out the cystocele also with full bladder?
Yes.
How to make out?
Before that, do we need to mention in your summary that she has or she hasn't got the problem of urinary incontinence?
देखिए.
Do you need to mention in your history summary that this woman with this such and such has or hasn't got the problem of urinary incontinence?
See, that comes in history only.
Have you examined during your examination time, have you tested for that of the evidence of involuntary leakage of urine, asking the woman to cough or stress? Do you think this is essential part of the examination? Because, you know, by and large, this is a case of conventional,
Prolapse.
that of the advanced prolapse.
Commonest
she is going
condition.
to have this vaginal surgery, vaginal hysterectomy, repair of the pelvic floor. Question arises, is she suffering from or is she not? Then question comes, are we going to take care of the incontinence
part?
Because rest of the problem in India, we are very much conversant with
Correct.
this.
Correct. How you examine for stress incontinence?
With the patient with full bladder, we'll
With
ask
full
her to
bladder.
strain.
Most important thing, which position you will give to the
You
patient?
can see in either a dorsal position or standing position, sir.
Standing, nobody will accept.
Exact, sir.
So it has to be a dorsal position.
position.
Where you will stand when you examine this patient for SUI?
To the right.
You should never stand in front of
To
patient.
the right of the patient. As
If
it
you
is to
stand
the
in
right
front
the
of patient, your apron will be soiled. So you should always stand on right side of the patient and ask her to cough and check whether the jet is going to come. How much amount of leakage the patient will have if she has SUI?
Just 5 ml is enough to diagnose.
It's a very small quantity and that's in jet. And suppose she is having urge incontinence, then how much quantity she will leak?
She leak large quantities, sir.
Complete bladder.
Almost empty bladder.
Before she reaches the proper place, she will evacuate or empty the complete bladder. Right? Which type of cystocele will give rise all the symptoms? Central cystocele. What do you mean by this?
It is the defect in the mid part of the pubocervical septum.
Lateral cystocele,
Paravaginal defects are there, sir.
apical cystocele,
Because above the interuratric ridge,
But all the muscles are inserted. There are nearly 9 muscles are inserted. So we need to reconstruct.